Hi, today I would like to talk to you about Sam. Sam came to us with a real need for life insurance. He had a mortgage and he wanted to make sure that if something happened to him, that his wife would be able to repay that mortgage and have that security of having the family home. Sam came to us for a couple of reasons. He was a 55-year-old male, non-smoker. The first reason was that about 3 years prior speaking to us, he had had a skin cancer diagnosis. So he'd had a stage 1A skin melanoma. He'd had to have 2 operations to remove it. The first one to actually remove the cancer itself, and the second one was kind of a just-in-case procedure, just in a slightly wider area to make sure that all the skin cancer cells had been gotten. It was about the size of a thumbnail in the end. About 2 years prior to speaking to us, he'd been given kind of his final check and the all clear, which was obviously fantastic for him. The other thing was that Sam had quite a high BMI. His BMI was at 45. So we had to do obviously some research and find the best insurer that was okay for both of those reasons, for the skin cancer and for the high BMI. And what I'm pleased to say is that we were able to get Sam life insurance to match his mortgage, so a decreasing life insurance of £40,000 over 12 years for a monthly premium of about £22 per month. One of the things that can sometimes be sort of like a little bit of confusion when it comes to these things is sort of when you get a loaded premium or a higher premium, and people can be a bit uncertain as to just how much the premium is going to shoot up, especially if someone's had cancer. They can be concerned that the premiums are going to become ridiculously high. Now, what I would like to say in this situation with Sam is that the premiums were increased. So obviously £22 per month was the increased premium. It wasn't any higher than that because of the medical conditions. But the really important thing here is that the premium was increased due to his BMI. It wasn't increased due to the cancer at all. As an advisor, there's quite a few things that you can do to really support a client when they come to you and they are wanting that support, and they've got these health conditions. So when it comes to something like cancer, the majority of the time, the main cancers that you're going to be speaking about, probably, you're going to need to know things like the staging and the grading. When it comes to things like prostate cancer and other ones like leukemia, so like a blood cancer, you do need to know different ratings. So it could be worthwhile sort of having a quick look, maybe even on the NHS, to find out what those readings will be that you need to know about, or even speaking to an underwriter beforehand to make sure that you ask the client everything that you need to know straight away. So the main things are the staging and the grading, the time that they were diagnosed, the treatments that they had and the time frames of those, the time that they've been given the all clear, and then the sort of what's sort of like the next stages. Do they keep having these annual checks? Are they having long-term medication? What are the dosages of that? Now, some people obviously, when they hear cancer and they're going through these treatments, there's kind of a mix. Some people know every single thing that they've had, the treatments, every single note that the doctor's given them, every kind of different reading that they've had in regards to their cancers. Other people will have maybe taken part of the information in, and some people may not have sort of kept a lot of that information to hand. It may be too emotional to keep that information to hand, and they've needed to kind of put it to the back of their mind. If that is the case, then what you can do is suggest that they maybe try and speak to either the specialist or their oncologist nurse, or potentially even just their GP. It can be a quick phone call sometimes just to find out those readings that you will need as an advisor to be able to get that accurate kind of quotation from the underwriters. And that's something that's really, really important as an advisor, because especially when it comes to things like cancers, it can make a massive difference, depending upon these stagings, these gradings, the treatments, everything. It can make a huge difference as to whether or not somebody may be declined at some insurers, whether or not there's going to be a premium increase, and whether or not that's going to be a percentage or a per mil. So really, I think the main thing is just to try and get as much information as you can beforehand. And I think that's probably the main things to point out.